Chalo. So in previous classes, I think we have discussed about pharmacology of antihistamatics. In that we covered sympathomimetics. In that we have discussed about beta 2 agonist, and we have also seen about methyl xanthines. These two classes of drugs were completed. Okay. In today's class, we will try to study about anticholinergics. So anticholinergics are third category of drugs which are considered as bronchodilators. Okay, in bronchodilators we have three: sympathomimetics, methylxanthines. These both were completed, and in today's class we'll try to discuss about anticholinergics. See, before understanding about anticholinergics, let me give you some basic points, important points. Everyone should listen very carefully. Okay, we need to know some basic points. First of all, we need to know about some basic points about cholinergic system. Cholinergic system, ध्यान से सुनो. See, we have cholinergic drugs, and we have anticholinergic drugs. Anticholinergic drugs. I think everybody have listened this term: cholinergic drugs and anticholinergic drugs, right? Now, what is cholinergic drug, or what are called cholinergic drugs? सुनो, ध्यान से सुनो सब लोग. The drugs which will mimic the actions of acetylcholine. The drugs which will mimic, or the drugs which will act like acetylcholine, are called cholinergic drugs. And the drugs which will show negative actions of acetylcholine are called anticholinergic drugs. Clear this point, everybody? Cholinergic drugs किसको बोलते हैं? The drugs which will act like acetylcholine, or the drugs which will mimic the actions of acetylcholine. And anticholinergic drugs किसको बोलते हैं? The drugs which will act against acetylcholine. They are called anticholinergics. अब देखो, सुनो, ध्यान से सुनो सब लोग. See, acetylcholine acts on 5 different receptors in our body. We have M1 receptor, M2 receptor, M3 receptor, M4, and M5. These receptors are called muscarinic receptors. Acetylcholine, what it does? Acetylcholine will stimulate these muscarinic receptors, and it will show all the actions of muscarinic receptors. That's why cholinergic drugs are also called as muscarinic agonist. Simple. अब देखो, M1 receptor, particularly M1 receptor is present in the stomach, especially on the gastric glands. सब लोग ध्यान से सुनो. M1 receptor is present in gastric glands. जिंदगी भर याद रख लो ये सब चीजें. M1 receptor is present on gastric gland and also in brain. I will not tell all the systems, all the tissues, just important tissues I'll tell. M1 receptor कहाँ कहाँ है? One is on the gastric glands in the stomach, and second it is present in the brain. Okay. Now M2 receptors are mainly located in the heart. M3 is very, very important, which is having more significance in the asthma. M3 receptors are present in GIT, gastrointestinal tract बोलते. It is present in urinary system. M3 receptors are present on the blood vessels. They are present on the blood vessels, and M3 receptors are also present in the lungs. ध्यान से सुनो ये चीज, very, very important. And see, M4 and M5 receptors are present in CNS. CNS means in the brain, central nervous system, in the brain. They are present in the brain. These points already you have studied. I am just revising all these points. Now you see, M1 receptors, I told M1 receptors are present in gastric glands. When M1 receptors are stimulated from the gastric glands, all the gastric secretions will increase. All the gastric secretions will be increased. It will increase the production of gastrin hormones. It will increase the production of all enzymes. It will increase the production of acid, HCl. Okay. Number two, when M1 receptor is activated in the brain, what it does, it will increase cognitive power. It will increase cognitive power. Cognitive power means concentration power बढ़ जाएगा. Patient will have memory power. Patient will increase memory power. So whenever our sympathetic system, particularly M1 receptor, is activated, एक बार सुने तो बस. If you listen once, you will memorize it. That especially M1 receptor increases cognitive power or memory power or memorizing power. That thing you have to remember. And some scientists, what they tell, whenever you relax, or whenever you do yoga, or when you listen to some music, soothing music, or when you are very happy, in that situations M1 receptors are mainly activated, and you will be relaxed, and your memory power will be more. Like that some physicians and some scientists say. Okay. We understood M1 receptors are located in the gastric glands and in the brain. If they are activated, it will cause all gastric acid or gastric hormones, it will release, and in the brain it will increase cognitive power. Clear? Now, M2 receptors are present on the heart. And when M2 receptors are activated, it will depress the heart. It will depress the heart. It will depress the heart means it will decrease the AV conduction velocity. It will decrease the heart rate, and it will decrease the force of contraction. Okay, it will cause negative inotropic effect. It will cause negative gonotropic effect, and it will cause negative chronotropic effect. Okay, so all these actions are depressive actions. Heart rate decreases, heart force of contraction decreases, and AV conduction velocity decreases. Okay, this is the action of M2 receptors on the heart. Clear? Now M3 receptor, on M3 receptor, when M3 receptor activates in the GI tract, it increases peristaltic movement. ध्यान से सुनो, it increases peristaltic movement in the smooth muscles of the GI tract. The smooth muscles of GI tract, peristaltic movement increases. What it does, it will increase peristaltic movement, and it will relax the sphincter of anus. Anal sphincter रहता है, it will relax. If muscles, smooth muscles are contracting, okay, if smooth muscles are contracting and if sphincter muscle is relaxing, what will be the end effect? What will be the end effect? Anybody from the class? Very good. It will cause defecation. It will cause defecation. GI tract में M3 रिसेप्टर एक्टिवेट हुआ तो it will cause defecation or diarrhea. Defecation बोल सकते simple. Clear? Number 2, on the urinary system. On the urinary system also same. See, we have urinary bladder, and we have urethra. Urinary bladder, we have urinary trigone muscles, smooth muscles in the urinary bladder, and we have sphincter here on the urethra. In urinary bladder also it constricts the detrusor muscles. जो bladder के ऊपर है detrusor muscles are contracted, and it will relax the urinary sphincter. Urinary sphincter is relaxed. So what it does? It will potentiate the urination, or it will cause urination. On the GI tract it is causing defecation. On the urinary system it is causing urination. The actions of M3. And on the blood vessels, ध्यान से सुनो, on the blood vessels are made up of endothelial cells, right? Blood vessel के अंदर innermost layer is having endothelial epithelial cells. These endothelial cells will release nitric oxide, NO. This NO will cause vasodilation. In last class I told, it will cause vasodilation. When M3 receptor is activated on the blood vessels, it will release NO, and through that it will cause vasodilation. On the blood vessels, M3 receptors will cause vasodilation. Clear? And see, now very important point, on the lungs, if M3 receptors are activated, it will cause bronchoconstriction. It will constrict the bronchial smooth muscles. Simple. It will constrict the bronchial smooth muscles, and through that it will cause bronchoconstriction. So this is the third, these are the actions of M3 receptors. And M4, M5 receptors are present in the brain. In the brain, it will show all cognitive actions. Just now I explained you. Clear? See, these M1, all muscarinic receptors are activated by acetylcholine, right? If any drug stimulates, or if any drug acts like acetylcholine, they are called cholinergic drugs. And anticholinergic drugs are those drugs which will show negative action, or which will antagonize the muscarinic receptors. Anticholinergic drugs also can be called as anti-muscarinic drugs. Yes or no? Anticholinergic drugs are also called anti-muscarinic drugs. Yes or no? Yes, sir. Yes, very good. Now you see, now we will go back to the classification. See, anticholinergics, actually in the bronchodilators we have third category which are called anticholinergics. Anticholinergics, what these drugs are doing? What anticholinergics are doing? Anticholinergic drugs are antagonizing the actions of muscarinic receptors, or they are showing negative action of acetylcholine. Clear everybody? Clear everybody? Anticholinergic का meaning क्या है? The drugs which will show negative actions on the muscarinic receptors. I think this point is clear for second year students. I am stressing because second year students, they are listening for the first time. Okay, now you see, if you have any doubt, you have to ask again. Unmute your mic and see one more point. M3 receptors are also present on all exocrine glands. Exocrine glands रहते हैं अपने body में. We have sweat glands, we have salivary glands, we have lacrimal glands in the eyes. Okay, all those glands also will be stimulated by activating M3 receptors. That point I skipped actually. Okay, now you see. Now everybody should listen very carefully. Everybody should listen carefully. We have anti-muscarinic drugs or anticholinergic drugs. Anticholinergic drugs. Actually, in anticholinergic drugs, we have so many categories. In anticholinergic drugs, we have so many categories. We are discussing only about the drugs which will act particularly on the lungs. But along with this category, we have so many other categories of anticholinergic drugs. Let me just summarize the anticholinergic drugs. See, we have Number one, I am talking about anticholinergic drugs. About cholinergic drugs, I have not discussed. That we will discuss in some other class. Anticholinergic drugs are the drugs which will show negative actions on the muscarinic receptors. Clear? See, anticholinergic drugs, the first class is we have some drugs called mydriatics. Mydriatics. These drugs, what they do, they will cause mydriasis. Actually, when acetylcholine falls on the eyes, it will cause meiosis. It will cause meiosis. And when anticholinergic drugs are given, they will cause mydriasis. That is opposite action, because anticholinergics will show opposite action, right? So in anticholinergics we have mydriatics. In that, one best drug we have cyclopentolate. Cyclopentolate is one drug. Cyclopentolate, this drug is used as mydriatic drug, or which is used in meiosis. अगर किसी भी पेशेंट में meiosis है तो in that condition we use mydriatics. Now what is meiosis, by the way? In see, for in first year I explained in the anatomy and physiology. You should explain, you should tell Prajwal and all. What? Yeah, someone was answering. Yes, very good. Constriction of pupils, or the pupil size in the eyes will be decreased. See the black color spot what we have in the eyes, that will be constricted, that will be decreased. Uska size kam ho jayega, that is called meiosis. And mydriasis is the condition where the pupil size will increase. Pupil size बड़ा हो जाता, that is called mydriasis. अगर किसी पेशेंट में meiosis है तो क्या है? We have to give anticholinergics. In that anticholinergic, the best drug is cyclopentolate. Cyclopentolate के साथ और एक ड्रग भी है tropicamide. ये ड्रग्स पर याद रख लो. These drugs will be helpful in competitive exams. Tropicamide. In hospitals we usually don't use tropicamide. इसके सिग्निफिकेंस इतना ज़्यादा नहीं रहता हॉस्पिटल में. We don't use commonly. So first category of anticholinergics or mydriatics. In mydriatics, what we have? We have cyclopentolate and tropicamide. And second class of drugs as anticholinergics, we have pre-anesthetic agents. In pre-anesthetic agents, very, very important drug we have. There is a drug called glycopyrrolate. Very, very important. Glycopyrrolate. सुने नाम ये? How many of you heard about glycopyrrolate? कोई नहीं सुने? See, glycopyrrolate का एक significance है. Everybody listen carefully. See, I want to tell you one point. All anticholinergic drugs are atropine drugs. You know this point, atropine. Have you heard about atropine? Anybody? See, atropine, सुनो सब लोग ध्यान से सुनो. Atropine is a strong anticholinergic drug, or it is a very, very strong anti-muscarinic drug. Atropine, we have atropine and hyoscine. Have you heard about hyoscine or scopolamine? These atropine and scopolamine are naturally occurring anticholinergic drugs. These two drugs are naturally occurring anticholinergic drugs. Atropine is obtained from Atropa belladonna plant, and scopolamine or hyoscine is obtained from Hyoscyamus niger करके plant है. From these two plants we usually obtain these drugs. पुराने जमाने में देखो, in previously before atropine was discovered, if anybody was having bronchoconstriction, India में specifically, in India we used to give datura leaves. You know datura? सुने नाम datura? हाँ, datura actually it is a toxic. This datura plant was used for asthma conditions. Actually datura में ना atropine रहता ना scopolamine. Datura doesn't have atropine or scopolamine, but it is having some alkaloids which will have anticholinergic properties. However, they are very toxic, but still in previous days we used datura, and बहुत सारे patients मर भी जाते थे due to the toxicity. Okay, so all these historical points we should know. तो देखो atropine and scopolamine both are naturally occurring anticholinergic drugs, and these both are very powerful anticholinergics, and these both the drugs are having unspecific actions. Unspecific actions means they will act on all muscarinic receptors starting from M1 to M5. So when they act on all the receptors, what happens? Patient will have different actions in the body. All the actions on all the systems is seen. That's why atropine and scopolamine are not commonly used in hospital. Okay, अब देखो. Now we are discussing about atropine derivatives, or the drugs which are very similar to atropine. In that first category we have seen is mydriatic. Cyclopentolate and tropicamide is one drug which is similar to atropine. but they are particularly used in ice as mydriatic because of their selective action. And second is pre-anesthetic agent. In that we have seen glycopyrrolate. ध्यान से सुनो, glycopyrrolate is one atropine derivative. This glycopyrrolate is very safe drug. Glycopyrrolate is very safe drug. Why it is safe, you know? सुनो, ध्यान से सुनो. Actually glycopyrrolate का main function क्या है? They are used as pre-anesthetic agent, right? Why glycopyrrolate is used as pre-anesthetic agent? Why glycopyrrolate is used as pre-anesthetic agent means, see, there is a condition called cyolaria. There is a condition called cyolaria. What is cyolaria? Anybody from the class? Cyolaria, can anyone tell me what is cyolaria? Can anyone tell me what is cyolaria? सुनो, ध्यान से सुनो सब लोग. We are discussing about glycopyrrolate. Very, very important. Pyrrolate. सुनो. It is used as pre-anesthetic agent, right? Pre-anesthetic agent. सुनो अभी. General anesthetic agents, especially when patient is given with general anesthetics before surgical procedures, this glycopyrrolate is used just prior to general anesthetics. Why? You know, this glycopyrrolate will particularly act on M3 receptors, and what it does, it will try to decrease the secretions of saliva, and it will also decrease the secretions of mucus in the bronchioles. Bronchioles के अंदर mucus जो भी है, that secretion will be decreased, and it will decrease saliva. It will decrease saliva. See, general anesthesia दे दिए तो क्या होगा? The swallowing ability of the patient decreases, no? And sometimes what happens, the saliva or the mucus secretions which are produced, sometimes they will be aspirated into the trachea के अंदर चले जाते हैं, and what it does, it will cause severe aspirating pneumonia, or it will cause obstruction in the bronchioles. So it is very dangerous condition. That's why glycopyrrolate is used as pre-anesthetic agent to decrease saliva production and to decrease mucus production in the bronchioles. Clear everybody? So pre-anesthetic agent is very commonly used agent. The glycopyrrolate is used as pre-anesthetic agent. Along with pre-anesthetic agent, glycopyrrolate, ध्यान से सुनो, glycopyrrolate is also used in a condition called cyolaria. Cyolaria is the condition where patient will have excessive production of saliva. Patient में saliva produce होते रहता. Saliva will not stop. Patient will be swallowing and saliva will be producing rapidly. रुकता ही नहीं. So in that cases, in excess production of saliva, glycopyrrolate is used, and excess production of saliva is called cyolaria. And let me add one point here. There are some conditions when patient has heavy metal poisoning, where there are some conditions called heavy metal poisoning, or there is a condition called Parkinsonism. Heavy metal poisoning, Parkinsonism, or if patient has mania, okay, if patient has mania, or if any patient has bipolar disorder, in these conditions, patient will have a condition called cyolaria. In cyolaria condition, glycopyrrolate is used. Glycopyrrolate tablets are available, and oral solution is also available, okay. So cyolaria क्या है? Excessive production of saliva. And there is one more point I want to add here. There is one condition called xerostomia. What is xerostomia? Can anyone tell me what is xerostomia? सुने नाम कभी भी? Exactly, dry mouth. See, xerostomia is commonly seen especially in overactivity of sympathetic system. Sympathetic system overactivity के टाइम पे, anxiety में, if you suddenly go and stand in front of the stage के सामने जाके, if you try to speak something for the first time, your mouth will be dried up. Why? You know, due to the increased production of sympathetic activity. Or in the anxious conditions, in that condition, what patient will have? Patient will have xerostomia. So in actually xerostomia एक chronic condition भी है. So in those cases, what we do, we use a drug called pilocarpine. What is pilocarpine? Anybody? Which category of drug this is? Pilocarpine will come under cholinergic drug. Why? Because in xerostomia, secretions of the mucus productions or secretion of saliva is decreased, no? Actually, cholinergic drugs, what they are doing, they are increasing the production of secretions, all exocrine secretions. Okay? Anyways, chalo, we are simply diverting the topic just to provide a lot of information. I'm simply going somewhere. We'll stick to the topic. Chalo, कहाँ पे थे अपन? We are discussing about anticholinergic drugs, right? In anticholinergics, We have discussed about pre-anesthetic agent. Now you see, now let me add some more points. Let me add some more points. Are you all following me? किसी को बोरिंग है? Are you feeling bored? Anybody? If you are feeling bored, let me know. I'll tell you some stories also. अब देखो, अब ध्यान से सुनो सब लोग. See, in anticholinergics we have discussed three drugs so far. Mydriatics we have seen, pre-anesthetic agent we have seen, and see, the third category of anticholinergic drugs we have the drugs which are used in asthma and COPD. In asthma and COPD, ध्यान से सुनो सब लोग. Asthma and COPD, anticholinergic drugs which are used in asthma and COPD. In that we have tiotropium bromide, ipratropium bromide, इप्रा सेकेंड ईयर स्टूडेंट्स वालों को ये सब नहीं सुने होंगे. इप्राट्रोपियम bromide, okay. Ipratropium and tiotropium, these are the drugs which are called anticholinergic drugs, particularly used in asthma and COPD. Okay, about this category of drugs I'll discuss in detail. Everything about these two drugs I'll explain. And the fourth category of anticholinergics, we have antispasmodics. Antispasmodics are the drugs which will decrease the spasms of GI tract or the urinary tract. Okay, these antispasmodics, we have one drug, very important drug called dicyclomine. How many of you heard about dicyclomine? Dicyclomine. Sune, this dicyclomine is used as antispasmodics. ध्यान से सुनो. If anybody has dysmenorrhea, what is dysmenorrhea? फटाफट बोलो. Very good. Painful menses, or if patient has lot of cramps, patient will feel lot of pain during menses. That is called dysmenorrhea. In dysmenorrhea, dicyclomine is very effective drug. What it does, it will decrease the contractions of urinary sphincters or urinary smooth muscles particularly. Okay, so dicyclomine is used in dysmenorrhea. It is also used in intestinal. There is a condition called intestinal colic. सुने नाम? Intestinal colic and urinary colic or renal colic. सुने नाम? If anybody has obstruction in the urinary ducts, or if anybody has obstruction in the small intestines and the large intestines, in that cases patient will have severe abdominal pain. Patient will have severe plank pain, especially in the kidney stone conditions. If kidney stones are coming from the kidneys into the ureter के अंदर अगर from the kidneys, if stone is obstructed somewhere in the ureter, what it does, it will show lot of pain. So in that case, it will cause renal colic. So in that condition also, dicyclomine. Yes, if anybody has renal colic, or if anybody has intestinal colic, intestinal pain, abdominal pain, urine pain, or plank pain, or urinary kidney stone pain, in that cases we can give. अगर देखो, अगर ब्लैडर में आके यहाँ पे if patient is having obstruction, in that case also dicyclomine should not be given. If that relaxes, what happens? The kidney stone will not come out, no? Kidney stone बाहर निकालने के लिए contract होना is important, but we are decreasing the contractions. Anyways, that concept is totally different concept. We'll discuss one day. One thing you have to remember: antispasmodics. In antispasmodics, we have dicyclomine. Dicyclomine is used particularly in dysmenorrhea. It is used in intestinal colic, and it is used in renal colic. In these three conditions, we usually use dicyclomine. Clear? And this dicyclomine is anticholinergic drug. It is anticholinergic drugs, or it is atropine analog, or friend of atropine, or it is related to atropine. Clear? Now you see, we have some other drugs which are anticholinergic drugs used in the hospitals. The fifth category of anticholinergic drugs, ध्यान से सुनो सब लोग, ये बहुत इंपॉर्टेंट है. Fifth category of anticholinergic drugs, we have some drugs which are used in organophosphate poisoning. Organophosphate poisoning करके poisoning we have. Organophosphates, actually organophosphates are the drugs which are cholinergic in nature. They will increase the actions of acetylcholine. अब acetylcholine action को कम करने के लिए अपने को ड्रग्स चाहिए. उसमें पावरफुल, सबसे पावरफुल एजेंट क्या है? Atropine is very powerful anticholinergic agent. So in organophosphate poisoning also atropine and atropine derivatives are used. And see, if anybody has organophosphate poisoning, particularly in pregnancy, if patient has organophosphate poisoning in pregnancy, Can you give atropine? Can you give atropine? We should no, we should not give atropine. In that case, do you know any drug of choice? Exactly, very good. Glycopyrrolate is the drug of choice in OP poisoning conditions. That is important point. Glycopyrrolate is also anticholinergic drug. We can reduce the antimuscarinic actions. Or we can decrease the muscarinic actions. Anyways, that is fifth category. And see now next sixth category, we have some anticholinergic drugs which are used in cardiovascular system. In cardiovascular system, particularly if anybody has sinus bradycardia, if anybody has sinus bradycardia, in that case, we can use anticholinergic drug. Okay, if anticholinergic drug is used in sinus bradycardia, what it does, it will stop the M2 receptor activity. It will stop the M2 receptor activity, and by that, what it does, it will increase the heart rate. It will increase the heart rate. So in sinus bradycardia, sometimes in sinus bradycardia, we have atropine. Atropine can be used. Atropine can be used. This is because of vagolytic effect. Actually, we have vagus nerve. Vagus nerve is innervated into the stomach. It is innervated into the small intestines, into the heart, and into the other abdominal areas. Okay, so it will cause bradycardia in the stomach. It will cause acid secretion in the stomach. These all things we have seen. Now you see, in cardiovascular system, atropine is used as atropine is used in sinus bradycardia, right? See, there are some drugs which are also used for peptic ulceration. अगर किसी पेशेंट में पेप्टिक अल्सर हो गया तो एंटीकोलिनर्जिक ड्रग यूज कर सकते हैं. Why? Because anticholinergic drugs will inhibit the M3 receptor activity, and in that we have some drugs called pyranzipine. सुने नाम? Have you heard about pyranzipine? Pyranzipine करके एक ड्रग है. Pyranzipine, what it does, it will actually, ये सब ड्रग्स आज के ज़माने में यूज़ नहीं कर रहे, बट in previous days we used anticholinergic drugs for peptic ulcers. Okay, pyranzipine is one example. And finally, I want to add one point. Seventh category of anticholinergic drugs. Anticholinergic drugs are also used in Parkinsonism. Parkinsonism is the condition where patient will have muscle twitches. Patient पूरा हिलते रहता. So in that case, what we have to do, we can give anticholinergic drugs. Actually, anticholinergic drugs will decrease the contractions of smooth muscles, and through that it will decrease the tremors and kinesis of the patient. So in that, actually, we have the, याद रख लो, anticholinergic drugs. See, Parkinsonism में the main drug of choice is levodopa. ये सबको पता है, levodopa. Levodopa is the drug of choice in Parkinsonism. This everybody knows. Now, in the exam, they may ask, give some anticholinergic drugs which are used in Parkinsonism. Parkinsonism में anticholinergic drug क्या है? याद रख लो सब लोग. This is a very very important competitive point. याद रख लो, B. What is BBB? Blood brain barrier, right? Actually, there are some centrally acting anticholinergic drugs. Brain के अंदर anticholinergic drugs we have. The drugs which will act in the brain, which will cross BBB. In that you remember, 1B is benztropine. 1B is benztropine. Second B is biperidine. And third B is, और एक भी था क्या, बेंजहेक्सोल. क्लियर, याद रख लो सब ये. दिस थ्री बी और दी सेंट्रली एक्टिंग एंटीकोलिनर्जिक ड्रग्स. वन इज बेंजट्रोपिन, वन इज बाइपेरिडिन, एंड वन इज बेंजहेक्सोल. क्लियर सब लोग? So these are some anticholinergic drugs. Now we will go back to the anticholinergic drugs which will act as anti-asthmatics. अस्थमा में कौन से ड्रग्स यूज करते हैं? In asthma we have इप्रोट्रोपियम ब्रोमाइड एंड टायोट्रोपियम ब्रोमाइड. ध्यान से सुनो, यहाँ से अब एक्चुअल टॉपिक स्टार्ट होगा. इप्रोट्रोपियम ब्रोमाइड and tiotropium bromide, these two drugs are anticholinergic drugs which are used in asthma. Actually, acetylcholine, what it is doing, acetylcholine is causing bronchoconstriction by activating M3 receptor. Now what we are doing, we are inhibiting this M3 receptor and we are decreasing the acetylcholine activity, and through that we are causing bronchodilation. Simple. Now what is the mechanism of ipratropium bromide? Suno, ipratropium bromide and tiotropium bromide, one is I and one is T. IBr ipratropium bromide and TBr tiotropium bromide. Ipratropium bromide will act for 6 hours. Its duration of action is for 6 hours, and tiotropium bromide will act for 24 hours. So ipratropium bromide is short acting anticholinergic drug. Yes, anticholinergic drug. and tiotropium bromide is long acting anticholinergic drug clear. अब ध्यान से सुनो सब लोग, ध्यान से सुनो. See, in asthma what I told, in asthma what I told, if anybody has asthma, whatever the mechanism is, actually asthma के अंदर बहुत बड़ा mechanism है. There are so many cytokines, we have so many leukotrienes, we have so many interleukins. Okay, when allergen comes and exposes, or when allergen attacks the lungs, it will cause cytokines or inflammatory mediators, and it will cause bronchoconstriction, simple, or it will increase the mucus production, or it will increase the hyperactivity of the lungs. When bronchoconstriction occurs, if anybody has bronchoconstriction, now what we can do, we can give bronchodilator, or we can decrease the patient's inflammation in the bronchioles, or we can decrease the mucus production. Okay, so all these things we can do. Now in bronchodilators already we have discussed about direct bronchodilators, sympathomimetics, and methylxanthines. Now third category is anticholinergics. These anticholinergics will go and bind on the M3 receptors. They will decrease the actions of M3 receptors, and by that what they do, they will cause bronchodilation. Simple. M3 receptor will be blocked by this ipratropium bromide and tiotropium bromide, and it will cause bronchodilation. Now one more important, very very important point about ipratropium bromide and tiotropium bromide. ध्यान से सुनो. These anticholinergic drugs, these two anticholinergic drugs are very very specific, very specific to, M3 receptors, and they are very slowly absorbed into the bloodstream. So their bioavailability or systemic absorption, ध्यान से सुनो, systemic absorption of ipratropium bromide and tiotropium bromide is very low. Systemic absorption of ipratropium bromide and tiotropium bromide is very low. That's why these both the drugs will not show any systemic actions. Systemic actions are not seen with these anticholinergic drugs, and that's why they are used only in asthma and COPD conditions. Why? Because they are very specific to, M3 receptors, and if they are given through inhalation route, particularly if they are given through inhalation route, they will act only on lungs. That's why anticholinergics which are very safe, which are not having specific action, is ipratropium bromide and tiotropium bromide. Clear this important point, everybody? This point you have to remember. Now let's go to the formulations. See, for ipratropium bromide, we have powder inhalant form. In last class I told salbutamol is available in rota caps as powder. That powder rota cap is destroyed, and that powder is inhaled by the patient through mouth. Actually, ipratropium bromide and tiotropium bromide should be inhaled by mouth only, not through nose. Okay, they should be inhaled by mouth only. So diolin करके बहुत famous है. This we have ipratropium powder along with salbutamol. Usually this ipratropium bromide is available with salbutamol. Okay, and we also have a metered dose inhalers, MDI. Metered dose inhaler के बारे में in last class I explained. Okay, here we can set the meter in every inhalation. जितना भी dose अपने को चाहिए we can decide. Okay, we can fix here. Okay, through that. And there are some without fixing also, directly in single inhalation or in single spray. In single spray we have 100 mcg, 200 mcg, like that metered dose inhalers we have. Okay, so this is also available with ipratropium bromide. Actually here we have combination, and we have rota caps also for ipratropium bromide and levosalbutamol, and directly ipratropium bromide recipients also we have. Okay, this recipients के बारे में भी in last class I told. They are inhalation solutions. They are used in the nebulizer में use करते. Okay, so these are different formulations of ipratropium. Ipratropium bromide is short acting. It will act only for 6 hours, up to 6 hours. That's why ipratropium bromide is commonly used with levosalbutamol. Levosalbutamol also acts up to 4 to 6 hours. Okay, so that's why ipratropium bromide is added with salbutamol. Tiotropium bromide is not added. देखो कहीं भी देखो tiotropium bromide is not added. अगर tiotropium bromide is given, it is given alone because its duration of action is 24 hours. Its compatibility is not seen with levosalbutamol. अगर tiotropium bromide if you are giving, we have to add with other bronchodilator whose action is between 18 to 24 hours. Okay, long acting drug के साथ देते. This is about ipratropium bromide. Clear? Now next is we have tiotropium bromide. See, tiotropium bromide, the duration of action is 24 hours. That's why it is available in separate form. We have inhalant solution as metered drug, and we have अनदर मीटर ड्रग में यूजुअली अवेलेबल रहता है एंड इज ऑल्सो अवेलेबल एज रोटा कैप्स. ओके, इट्स ड्यूरेशन ऑफ एक्शन इज 24 hours. And hospital में we very commonly used drug is ipratropium bromide and levosalbutamol in the combination for acute asthma as well as in maintenance conditions. Clear? Now I want to add some important points about anticholinergic drugs which are used in asthma and COPD. Number one, in anticholinergic drugs for asthma we have two drugs. First one is ipratropium bromide, and second one we have tiotropium bromide. My mouse is not working properly. Okay, that is first. And see, I told one more point. Their mechanism is very simple. They will inhibit M3 receptors, and through that they will cause bronchodilation. Very simple. This is second point. And third point, they are having very selective actions, and they'll act on the lungs only. They will not show actions on the systemic tissues. And now one more very important point. If we talk about the adverse effects, ADRs of anticholinergic drugs, particularly ipratropium bromide and tiotropium bromide, no major ADR is seen with these drugs. But one ADR we can see, and that is patient may have dry mouth because we are taking through mouth. No, if we inhale through the mouth or when we take the metered dose inhalers, the drug may accumulate in the oral cavity. That's why it may cause dry mouth. Why it will cause dry mouth? Why ipratropium bromide and tiotropium bromide will cause dry mouth? Anybody from the class? Why it will cause dry mouth? Anybody? Yes, simply you have to tell anticholinergic action. एंटीकोलिनर्जिक के एक्शंस क्या क्या है? एंटीकोलिनर्जिक के एक्शंस क्या क्या है? it will show dry mouth. It will decrease gastric peristaltic movement. Actually ये दो drugs, they will not cause constipation, but I am just telling you the anticholinergic actions. In the stomach, in the mouth it will cause dry mouth, in the stomach it will cause constipation, and in the urinary tract it will decrease the urine output, and on the muscles it will relax muscles, and on the blood vessels it will constrict the blood vessels. Okay, अब देखो खोलिनर्जिक एक्शंस क्या है? जिंदगी भर एक चीज याद रख लो. आई जस्ट नाउ आई एक्सप्लेन यू द एक्शंस ऑफ M1, M2, M3, M4 and M5. जस्ट टू समराइज, याद रख लो वन सिंगल निमोनिक SLUDGE. दिस निमोनिक यू हैव टू रिमेंबर. जिंदगी भर ये निमोनिक याद रख लो. खोलिनर्जिक एक्शन मीन्स you have to remember acetylcholine. Cholinergic action means acetylcholine, pilocarpine, organophosphates, pyridostigmine, neostigmine, वो सब आएंगे. एंड cholinergic action के अंदर क्या है? SLUDGE. S means salivation, L means lacrimation, U means urination, D means defecation or diarrhea, G means gastric upset or gastritis, and E means emesis or vomiting. जिंदगी भर याद रख लो ये पॉइंट. स्लड्ज इज दी खोलिनर्जिक एक्शन. एंड एंटी खोलिनर्जिक एक्शन क्या होगा? स्लड्ज के पूरे ऑपोजिट. सैलिवेशन कम हो जाएगा, लैक्रिमेशन कम हो जाएगा, यूरिनेशन कम हो जाएगा, डेफिकेशन कम हो जाएगा, गैस्ट्रिक सिक्रेशंस कम हो जाएंगे, एमिसिस भी कम हो जाएगा. सो ऑल एंटीकोलिनर्जिक ड्रग्स विल हैव एंटीकोलिनर्जिक, स्पेशली अनस्पेसिफिक एंटीकोलिनर्जिक्स. सैलिवेशन कम कर देगा, लैक्रिमेशन कम कर देगा. यस और नो? यूरिनेशन विल बी डिक्रीज्ड, डेफिकेशन विल बी डिक्रीज्ड, पेशेंट विल हैव कॉन्स्टिपेशन, gastric secretions will be decreased, patient will decrease emesis, and patient will have anti-emetic actions. That's why glycopyrrolate is used as anti-emetic drug also. Dicyclomine is also used as anti-emetic drug. Okay, dysmenorrhea के साथ साथ अगर patient को if anybody is having emesis or if anybody has vomitings, dysmenorrhea के साथ vomitings है तो क्या ड्रग दोगे आप? dysmenorrhea के साथ vomiting है तो क्या ड्रग दोगे? Anticholinergic dicyclomine you'll give. Dicyclomine has antispasmodic action as well as anti-emetic action. Okay, बाकी के दूसरे actions भी रहते हैं, but these are dominating actions. I think all second years are following me. Yes? Okay, अब देखो तो ipratropium bromide and tiotropium bromide के adverse effects ज़्यादा नहीं है. We don't have lot of adverse effects, but only one known adverse effect is it may cause dry mouth. Simple. इससे ज़्यादा कुछ भी नहीं है. And they are very safe. They are very tolerable. Many patients will tolerate these drugs, and they are commonly added with salbutamol, especially levosalbutamol, and sometimes they are also added with methyl because when they are interacting with methyl or other bronchodilators, their synergistic effect will be increased. Clear? These are the important points about anticholinergic drugs used in asthma. You understood what is cholinergic action. You also understood what is anticholinergic action. And in anticholinergics, we discussed about some other examples. And in that, especially used anticholinergic drugs in asthma, we have discussed. In that, we have ipratropium bromide and tiotropium bromide. Clear? And see, one more important point I want to add here. See, along with ipratropium bromide and tiotropium bromide, कहाँ गई है? Classification is here. See, in this classification I didn't mention the names. Ipratropium bromide is short acting, yes. Tiotropium bromide is long acting, yes. Along with these two, actually these two only used in hospitals, but along with these two there are some newer drugs. In some advanced textbooks you will find those drugs. फिर सर नहीं पढ़ा करके नहीं बोलना. There is a drug called aclidinium. सुने नाम कोई? aclidinium. Fourth year, fifth year students, you might have not heard about these drugs. These are newer drugs. Aclidinium is another anticholinergic drug, particularly used in asthma and COPD. Its duration of action is also around 24 hours. Okay, this is long acting. And we have one more drug, umeclidinium. Aclidinium and umeclidinium. Umeclidinium, DINIUM. Umeclidinium. Aclidinium and umeclidinium. These two are long acting drugs, long acting anticholinergic drugs used in asthma and COPD. हॉस्पिटल में ज़्यादा यूज़ नहीं करते, बट सबसे सेफ एंड वेरी इफेक्टिव ड्रग इप्रोटोपियम ब्रोमाइड इज देयर. ये छोड़ के दूसरे ड्रग्स के पास जाते ही नहीं. वी डोंट यूज अदर ड्रग्स. ओके, आई थिंक यू अंडरस्टूड दिस पॉइंट. क्लियर एवरीबडी? Now we'll go with the second category of anticholinergic drugs. We have leukotriene receptor antagonist. Leukotriene receptor, देखो, in last class while explaining about the mechanism of asthma, simple what I told. See, if anybody has allergen, if anybody exposes to the allergen, this allergen will go and stimulate the T helper cell 2, Th2 cells. Okay, Th2 cells. When these two Th2 cells are activated, it will release interleukin 5 and interleukin 4. Okay, this point I told. When this interleukin 5 and interleukin 4 are produced, they will further cause release of cytokines and inflammatory mediators. Especially they will cause release of leukotrienes mainly. When these leukotrienes are released, leukotrienes are inflammatory mediators. These leukotrienes will go and bind on the leukotriene receptors. When leukotrienes binds on leukotriene receptors, it will show 3 to 4 actions. Number 1, it will cause bronchoconstriction. It will cause hyperactivity, and it will also cause chronic cough. ये सब points already we have discussed. Now, if you inhibit this leukotriene receptor, अगर ये leukotriene receptor inhibit कर दिए तो क्या हुआ? Leukotriene जितना भी produce हुआ, this receptor is not activated, and through that all the bronchial asthma symptoms will be decreased. Yes or no? All the bronchial asthma symptoms will be decreased. All means we have some particular actions. Actually, when leukotriene receptor is activated, it will cause bronchoconstriction. It will cause inflammation. Especially leukotriene receptor activate हुआ तो क्या होगा? Bronchial inflammation होगा. Now, when this receptor is inhibited, bronchial inflammation will be decreased and bronchoconstriction will be decreased, and along with that hyperactivity also will be decreased. Clear the mechanism of leukotriene receptor antagonist बोलते हैं और leukotriene receptor blockers बोलते हैं. In that what we have montelukast, very important drug. We have montelukast, we have zafirlukast, and we have Xylitone. Actually Xylitone, एक चीज याद रख लो, Xylitone ये थोड़ा नया ड्रग है और थोड़ा lethal, not new, it is old drug only, but this Xylitone we don't use. This Xylitone का एक special action है. Montelukast and zafirlukast will inhibit leukotriene receptors. They'll inhibit leukotriene receptors, whereas this gelatin will inhibit 5 lipoxygenase 5 lipoxygenase. You know about lipoxygenase enzyme? How many of you know about lipoxygenase enzyme? How many of you know about lipoxygenase enzyme? See, ध्यान से सुनो सब लोग. Are you all following me? See, when cell membrane is ruptured, due to the bacterial invasion or due to the radiation or due to the physical damage or mechanical damage or due to any infection, when cell membrane is ruptured, it will form arachnoic acid by phospholipase A2 enzyme. Okay, arachnoic acid, from arachnoic acid we have lipoxygenase enzyme here, LOX, and we have COGS enzyme. Okay, COGS enzyme. This COGS enzyme will produce prostaglandins and LOX enzyme will produce leukotrienes, right? And here this xylitol will inhibit this LOX enzyme as well as the lipoxygenase, this enzyme. So what it does? Simply xylitol is showing same action like corticosteroids. Actually corticosteroids के बारे में आपको कुछ समझाया नहीं. I'll explain that in the next class. It is very very important. So xylitol, what it is doing? Xylitol is showing like corticosteroid action, which is inhibiting the production of arachnoic acid. First of all, arachnoic acid फार्म ही नहीं होने देगा. arachnoic acid फार्म नहीं होगा तो क्या होगा? All the inflammatory mediators, prostaglandins, leukotrienes कुछ भी रिलीज नहीं होंगे. And that's why it is called strong anti-inflammatory agent. चलो सुनो उसके बारे में, that we don't use actually. This is the speciality of this enzyme. Ab you should ask, sir, it is very powerful anti-inflammatory agent. No, it should be used. No, why we are not using this drug? Because it is having very lethal action on the liver. On the liver, it damages liver. It has liver toxicity. Because of this lethal adverse effect, we don't use xylitol in the hospital. And montelukast and zafirlukast, these are safest drugs. They are available as tablets, 10 mg, 20 mg. Okay, and they are very tolerable drugs and very safe drugs. Most of the leukotriene receptor antagonists, these drugs are absorbed orally. Orally absorption is very well. First pass metabolism nahi रहेगा like salbutamol and all. They are very well absorbed from GI tract and they binds to the plasma proteins. Okay, and the duration of action is up to 24 hours. And these drugs are mainly metabolized in the liver. Liver में metabolize होगा and they are excreted through urine. And they are very safe and they are not having major adverse effects. They are not having major adverse effects. One adverse effect is possible. See, with montelukast and zafirlukast, सब लोग ध्यान से सुनो. They may cause headache. They may cause headache. They may cause allergic reactions like skin rashes. Skin rashes cause कर सकते हैं, but very rare skin rashes. And very very important one, they will cause eosinophilia. Eosinophil count बढ़ा देगा. Why it causes eosinophilia? Why montelukast and zafirlukast causes eosinophilia? Because these drugs will increase, actually their production increase हो जाएंगे. Because these drugs are not acting on eosinophils, they are acting on the leukotriene receptors. I'll tell you the mechanism. See here, सब लोग ध्यान से सुनो. Why zafirlukast causes eosinophilia? See, whenever patient has asthma, okay, whenever patient has asthma, अब asthma triggering factor होगा तो inflammatory cells, mast cells, eosinophils सब ज़्यादा हो जाएंगे. And what they'll release leukotrienes, right? When leukotrienes releases, these leukotrienes will go and fall on the blood vessels. They'll cause vasodilation. They'll fall on the bronchial smooth muscles. They'll increase secretion. They'll cause bronchoconstriction. Okay, and all smooth muscles will be constricted, especially on the bronchial and bronchoconstriction होगा. Along with this, you see leukotrienes, what they do? Leukotrienes will recruit or they will bind the eosinophils or they will trap the eosinophils. We are giving montelukast or zafirlukast. Montelukast and zafirlukast will act on the receptors here. It will decrease mucus production. They will act on the blood vessels here, receptors here. It will decrease vasodilation, and we have leukotriene receptors on the smooth muscles. Through that, it will decrease bronchoconstriction. And but here, जो eosinophil recruit हो रहा है, the actions of leukotriene, this will be deteriorated, this will be decreased, and through that what happens? Eosinophil count will increase in the blood. Through that, it will cause eosinophilia. How many of you understood this point? Why zafirlukast and montelukast increases eosinophilia? मैकेनिज्म के अंदर ही है, इट्स वेरी इजी. ओके, so these are important points about Manteleucast, Saphir-Lucast and Xylitol. I think you all understood these two classes of drugs which are used in asthma and COPD. COPD के बारे में अभी कुछ नहीं, but they may used in COPD. We are discussing only about asthma. Clear everybody?